Hi, so today we're going to go through a standard shoulder strapping technique. We use this commonly in sports like AFL, rugby, and the aim of the technique is to effectively try and create some stability around the shoulder. There's a few variations on how we do this, but today we will go through a standard technique that just provides general stability for the shoulder and also to incorporate the AC joint. So what we do is we start first with our Fix-It under wrap. And this is a hypoallergenic tape. And the reason we use this is so that sometimes the skin can react to different types of glues, but because this is hypoallergenic, that removes the risk of a skin allergy happening. So when we apply this, the important things to remember are some landmarks. So the AC joint, we tend not to go past the AC joint, and also not to climb too much up towards the neck, because you can put some stress on these muscles here as well. So we just try and stay around the middle here, not too far down and not too far up. Our other landmarks is just around the nipple for men, and for women we can opt for taping across towards the front of the chest or around the axilla. But for today, for a male, we use a 10 centimetre technique. So what we do is we apply across just around the nipple area. Okay, there's no tension on this tape. Here's your AC joint. So we just apply the tape gently, and we try and avoid any type of creases. It's really important to have no creases in your technique. And we take that all the way down to the back, which we can't see in this video, but it looks about the same as the front. So there's similar application there. Okay, so that's one of our anchors. Our second anchor is just at the lowest part of the deltoid, and around the biceps and triceps region, so the sort of central part of the humerus. So we apply the technique, and we just ask our patient to tense their biceps and triceps muscle, because that happens during play, during sport. And so we don't want it to get too tight as they're playing. Just relax again for me. So that's another one of our anchor points. And our third is basically we set up for where we're going to guide the tape up and down from the shoulder down to the mid-arm, so along the humerus. So we just set that up as well. Okay, a couple of little creases there, not too bad. Okay, so now we've got I talk about these being our areas that we're going to work with. So for a male, a larger male, we use a 50mm rigid tape, and if it's someone a bit smaller, we might use a 38mm rigid. Okay, so what we do here, we follow where we've placed our underwrap, our Fix-It tape. Okay, again, not really too much tension with this application. Okay, we just come all the way down. Try not to go over the end. Okay, so we've got these anchors here, and now we apply our anchors along our lower anchor here. So just tense the muscle again for me. Okay, again, not too much tension here. Just applying the tape without the tension. Okay, so we've got our anchors here, and from here we can start to lay our tape that will provide some compression and some stability to the shoulder. Okay, so now we want to start to load up the shoulder. So here with the 50mm rigid, okay, so we go from distal to proximal. Okay, so we load up. So I use two strips to load up, okay. And we apply a bit of tension with that. And the reason we do that is to create this tension, creates elevation of the arm, so we get stability of the AC joint, so that's really important. Okay, and so from there, we start to load up with our herringbone technique. So coming across, again, providing some tension. Okay, so you can see, still applying that tension there. And again, just going more, we just go away from the central point, okay, so more, again, plenty of tension in the technique. So we're going posterior all the way to anterior. And you can see I'm still working relatively in the guide of my underwrap tape, so that's where I sort of, they're my barriers to where I do my technique. Okay, so for the third technique, rather than going more anterior, I start posterior to the first two strips, okay, and then I wrap around the back, okay, so I apply tension that way. So I start back and I end back. And the same goes with the front. So start forward and you end forward as well. Okay, and applying plenty of tension in that technique. And you get a nice herringbone technique there. Okay, so with this, there are some options. This is generally, this is a general stability. If you're looking to do something where you want much more aggressive anterior support, you can change your technique and start a bit lower down and coming around and wrapping around. However, the patient has to be tolerable to this spiral technique, but you can go a little bit more over the front of the shoulder and coming around the back. Okay, but that's for another lesson. So what we do from here is we're going to lock off what we've done. Okay, so what we do is we apply our anchors. Okay, so that's the first anchor. You can apply 2 or 3 at the top, just one for now. And anchor here again, asking your patient just to tense the arm. Okay, and so we apply a tape there. We can do 1 or 2 here, just one for now. Okay, so that's the end of our rigid tape technique as part of our overall technique. And now what we'd like to do is to actually lock this all off. With actually locking off our shoulder technique, you can see where I've done the wrapping around the humerus itself. I haven't gone all the way around. Now traditionally physiotherapists and other health professionals have gone all the way around. However, we feel that this can sometimes create this false tourniquet. So more of a modern technique is not to go all the way around, but in doing that then you must have some way of actually locking this all off. And we use the Stretch Band Plus, which is a more of an elastic bandage, which means when you wrap that around, it does provide a bit of stretch and a bit of give that rigid otherwise wouldn't allow for you. Okay, so with our lock-off technique, I generally start, if you're at the top of the shoulder, our first strip will be just below at the front. Okay, and this is a 75mm tape. When we go around, it's really important for men that you actually put your hand under the armpit, because there will be some hairs there generally, and we just protect that area, because when the athlete does lift their arm when playing sport, they'll have a problem with that if the hairs are grabbed. So we come around, we apply the tape around, and I tend to do a double technique, so I might come around a couple of times, but this is up to the individual. But I come right around and then I apply my rear technique. I come around. Okay, so because this tape doesn't cut, we have to use some rip it up. We have to use some scissors to cut it. Okay, so that's our first technique. And with our second, I go from rear to front. So I start here, come around again watching the hairs. That's it. Okay, and then we come back again with a. Make sure you put a bit of stretch on the tape and a bit of tension, not too much. It's not meant to be too tense, the technique. Okay, and from there then we finish at the front. Just cut the tape. Okay, so that's the end of that. So then from there we go back to our 50mm rigid. And we lock this off now. Again, no tension on this anchor. So just applying the tape gently. You can apply 1 or 2 of these anchors. Okay, to finish up, we use our 10cm fix-it tape just to basically finish off our technique. So we're effectively finishing as we started, so the tape goes over the initial fix-it tape, front to back, no tension, all the way down, just watching to avoid any creases. And because the glue on the fix-it tape, and these type of tapes, hypoallergenic tape is an oily acrylic, they do like heat, and so we do like to just warm the tape up, and especially in sport where the athlete likes to jump out of the chair and head out the door and start to compete, we just make sure everything's fixed. Okay, and I just apply a bit of tension. Just quickly, the reason why I've used the chair is that you allow yourself to control the patient's posture, and also there's easy access around the entire patient, whereas if you use a table you don't get that luxury. At this point I generally ask the patient to stand up, and I'll ask them to do a reaching manoeuvre, with, just like in AFL or rugby or other sort of sports, just to provide a bit of stretch to make sure the tape will hold. But generally if you apply the tape this way, that won't be a problem. And the reason we've used our Strap-it 38mm professional tape is for its superior strength. The tape has been tested in a lab to show that it has superior strength properties, and in the shoulder, because of the range of motion of the shoulder joint, with all these different ways we can move the shoulder and all different planes, the tape does have the capacity to tear. So by choosing the best, strongest tape on the market, you allow yourself the very best chance for the tape not to rip during sport, and that's the shoulder technique.